This clinical case is presented by CIFCO Medical Solutions. I am Dr. Lacoursière, Interventional Radiologist, and I'm going to present you a clinical case of a lung biopsy using a lateral approach with the RAD-GUIDE. The patient here is a brain-dead patient from a massive stroke who was considered for organ transplant. A chest CT revealed a small pulmonary nodule, and so the patient was referred to us for a CT-guided lung biopsy of the nodule in order to exclude an underlying lung cancer. The chest CT image shows the small subpleural pulmonary nodule in the right upper lobe. Considering the fact that the patient was intubated and under assisted ventilation, the anesthesiologist specifically asked me to try to avoid the prone position to perform the biopsy. So the patient was placed on a left lateral decubitus, and considering the fact that very little tissue support is available in that position, especially from a posterior approach in this patient, I decided to use the RAD-GUIDE to help me support the needles and help me to precisely reach this small subpleural nodule. So a radio-opaque grid was placed on the patient's skin, the entry point was chosen, and the RAD-GUIDE was placed on the patient's skin. Then a local anesthetic needle was inserted to help me choose the best path to reach the nodule with an intercostal approach. The purpose of the anesthetic needle is to show you on the CT image the skin entry point. Then you simply trace a line starting at the nodule and passing through the skin entry point and extending the line through the top plate. So this line will tell you exactly in which hole of the top plate you'll have to insert your guiding needle, and then using the core biopsy needle. So the guiding needle was inserted through the appropriate hole of the top plate. For the final few millimeters, track adjustment usually required, especially in lung biopsies. The top plate of the RAD-GUIDE is turned 90 degrees and drop on its base, and then a complete freehand control of the guiding needle is obtained and precisely moved forward just adjacent to the subpleural nodule. Finally, the top plate was placed in its original position, supporting the guiding and the trocar needle inserted, and the biopsy of the nodule performed. In this clinical case, the biopsy could confirm that the nodule was benign and the patient could be considered an organ donor. This clinical case showed us how the RAD-GUIDE really well supports needles, which is very useful in horizontal approaches, especially when very little tissue support is available. It increases needle precision, especially useful in small lesions. And finally, when it's necessary to get a complete freehand control of the needle, you simply have to drop the top plate on its base, move the needle as required, and you may even get the complete support of the RAD-GUIDE by bringing the top plate in its original position.